Hello, this is the review for the book Breast Cancer Surgery and Reconstruction by Patricia Anstett. I am a lymphedema therapist and an oncology massage therapist, so I'm going to focus on my review on why this book is an excellent addition to your library if you are an oncology massage therapist, if you help people after breast cancer surgery, if you're a lymphedema therapist. I'm going to have this review separated in a couple different sections. First, I'm going to talk about why this book is unique. Then I'm going to talk about some parts of the book that can help us improve our clinician presence. I'm going to talk about some specific things that I pulled from the book that can help us be better manual lymphatic drainage therapists, massage therapists to people who are undergoing a breast cancer journey. And last, I'm going to touch on some major themes that I found in the book that can make it valuable. So first, let's talk about what's unique about this book. So it comes to us, it is from 2016, so it is a few years old. So in that way, it kind of is a time capsule and a window into how our clients that have more than 10 years of breast cancer survivorship approach their breast cancer journey. It also, I love that the first story, the very first page of the book is a story of a person of color, of a woman of color. And I think it's important that we listen to and understand their lived experience with this breast cancer journey. It also has a Midwest perspective. A lot of the stories are from Detroit and Chicago area, and it has an Arab perspective. And this is talked to, it's shared with us from the perspective of clinicians that are working with the Arab community, people of Arab heritage, and how to help them through the breast cancer journey, from even convincing them to get a mammogram and potentially going through the diagnosis and the surgery. I think it's very valuable for us to learn that perspective, and it's woven throughout the book, and there's a very specific chapter that talks specifically about the Arab community. So that is what makes this book unique, and I think just that alone makes it a really great addition to our library. But let's look at some other things in the book that are also valuable. So first, we'll talk about clinician presence, and this is some things that we read in the book that, if we understand it from the perspective of our clients, can help us be better massage therapist. So one of the doctors says in the book, "Oh, you can never have too much surgery. We don't believe in anything like too much surgery." And this is absolutely wrong. I hear time and time again when we talk about why the journey happened in the specific way it happened for a client who is dealing with breast cancer in their life. A lot of times it will be, "Kathleen, that's too much surgery. I'm done with surgery. I want the surgeries to be over." Specifically, one of the women that was interviewed in the book said she felt like the marking of the surgeon's marking, she felt like before she went into surgery, she was marked up like a cattle for butchering. And then also very valuable in this book on page 175, they talk about pearls, Pearls, as a specific type of concept of guiding a conversation between a clinician and a patient that will help improve the clinician presence. And pearls stands for partnership. So you give partnership statements several times in the interview: emotions, apologizing, respecting, and understanding the value of silence. So read more about pearls in the book on page 175. So let's talk about some specific things that I pulled that are valuable for massage therapists specifically to understand. And this is, again, it's this time capsule of understanding better the journey of our clients that come to us that say, "Hey, I've in 5 years in survivorship, 10 years, 15 years in survivorship. Why were there so many mastectomies in the teens of the 21st century? What was the talk and conversation around genetic testing, people who are previvors? what was their experience and what was kind of the pause of just having the start of genetic testing, and when were people getting the genetic testing versus not getting the genetic testing for BRCA1 and BRCA2 mutations. Why were there some people not get reconstructive surgery? So to understand the whole journey, especially if it's over 20, 25, 30 years ago that your client had breast cancer, the reimbursement, the attitude, the understanding of reconstructive surgery was far different, especially different even in the last 10 years. It has changed. So that's why I say the book's from 2016, and we need to understand that even over the past 5 years, the way that breast reconstruction is handled is different than it was in the past. So if you're a very new therapist or just recently helping people with breast cancer, it's valuable to understand how people who have a decade or more since their breast cancer surgery would have approached and lived through their healing journey of the initial surgery and the reconstructive surgery. And why was there no physical therapy? Why did people not get the referrals to physical therapy? So that's interesting. It's very valuable for us to understand as a massage therapist, so we don't kind of like throw up our hands and just not understand the lived experience of someone who has a very recent versus a much older history of having breast cancer. So let's talk about some themes in the book. And I really love how they zeroed in on this first theme, the theme that breast cancer is curable, but it is cruel. And the treatment of it is cruel because so many of the side effects of the treatments of breast cancer go right to changing the things that are most valuable to a woman in expressing her femininity. So that is the changes that happen in her breasts, and chemo and radiation, the changes that happen in her hair, the changes that happen in her skin. And there's a line in the book that said, in the space of a few months, women can look like they've aged for 10 years. So that's an important theme to understand and have compassion for our clients. Also, the phrase bang, 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 which was how one person described the initial time period from the actual feeling a lump in your breast to getting the breast cancer surgery. And the space from diagnosis to surgery is very quick. And this may mean that there's not a lot of time for the woman to consider her reconstruction options fully. So this is a very cramped, tight time period. And just to understand that is a thing that happens when someone is going through breast cancer. And then also the importance of surgeon shopping. Just like in cosmetic surgery, you need to do your research and you need to find the best surgeon for you. Just like that in breast reconstructive surgery, the client should be encouraged that there's nothing wrong with surgeon shopping. There's nothing wrong with interviewing certain surgeons and feeling like you should go with the surgeon who best understands what you want versus just letting the health insurance company or, going with the flow and just getting the surgeon that's available on the day that you want to have surgery. And then also understanding, and this is very important to understand, that between surgery and fully reconstruction, the breast cancer journey is a multi-year process, multi-surgery process. There's a lot of moving parts going on, and you are not going to get from the beginning to the end in just a few months. It really is a multi-year process. Especially if you're going to have you're going to have many surgeries and you're going to separate the taking the cancer out surgery from the reconstructive surgery. More recently, in the 2020s, we've seen more immediate reconstruction versus having the expanders, but from the immediate reconstruction to everything calming down and the woman really getting the final result, it's still going to be a multi-month, multi-year process. And to understand that it's not ever going to be a quick fix when we're talking about breast cancer.